Hello and welcome to Prairie Pulse. Our guest for today's show is Faye Seidler with the Harbor Health Clinic in Fargo. Faye, thanks for joining us today.
Thank you.
As we get started, tell the folks a little bit about yourself and your background.
Sure. So my name's Faye Seidler, as you said. I've done a lot of work in this area for transgender advocacy, education, and rights. And I've done quite a few things for that in the last couple of years. I've written for the High Plains Reader for about 2 years doing Trans Corner. I led the North Dakota Safe Zone project that did research into looking at how to prevent discriminatory actions from happening in businesses, schools, government, just kind of all kinds of wakes of life. Beyond that, I've done a lot with Tri-State Transgender, which is a support group in this area. And recently I started Harbor Health Clinic, which is a clinic that treats trans patients. I do a lot of the stuff I do in this community because I didn't have any of it growing up. As a trans woman myself, I grew up in North Dakota. I grew up to our awful winters, to our unpredictable weather most of the time. And I grew up in the rural communities where there's this 10 to 100 people there and you pretty much knew everyone. And I didn't have a lot of resources or support growing up. I didn't have anyone I could turn to, anyone I could talk to, anyone who could help me. And a lot of the individuals that are there to help you when you fall, whether they be your parents, your friends, your guidance counselors, coaches, principals, therapists, whoever, they didn't have the adequate tools to help me when I was growing up in this state. So a little bit about my background is I do a little bit of everything for the trans community, the greater LGBTQ+ community, in just marginalized communities in general, mostly because I didn't have those resources or tools when I was growing up.
Okay. Well, then you say the clinic. Let's turn to the clinic.
Sure.
What is your role at the clinic?
I am the administrator of Harbor Health Clinic, which means I kind of do the day-to-day functions of the clinic. And that could be a lot to do with scheduling patients of the clinic, talking to them, making sure that they know when they should go to the clinic, where it's at. I also do a lot of the back-end things in terms of maintaining the website of our clinic, writing grants for it, looking for spaces and opportunities for our clinic to be able to grow. Just kind of everything that's not directly doing medicine and everything that's not directly being part of the nonprofit that hosts our clinic is my job.
Okay. With that said, and you may have sort of answered this,
Sure.
So how did the clinic start and why?
So that's actually a great story. Dr. Richard Lensmeyer, who's a doctor at our clinic, approached me when he was working at Family Healthcare, and he said, I've been looking at transgender healthcare, and I'm wondering how we are doing in our area in terms of supporting trans clients and trans patients. So I was like, that's great, let me send you an email, and that was about a 5-page email that I originally sent him. Afterwards, he's like, well, we should probably meet and talk about this. So then I met him, and we talked for about 2-3 hours, where I was talking about the need for healthcare for trans individuals, because before we started this clinic, we had one endocrinologist in North Dakota of 700,000 people that was treating trans patients, which means that patients were taking between 3 to 6 months to even be seen. Because they're going through Sanford, they don't have much options for reducing any of the costs of the medical care, so they're paying upwards of $1,500. So imagine going in for any other routine care visit and them saying, well, we can see you in about 6 months, and then having to wait that long before they will even give you any kind of treatment. So before we started this clinic, there was almost nothing out there for people. And when Dr. Richard Lensmeyer approached me and asked me about this, he got a wealth of information about the need of it. And then he and I worked together. We eventually contacted Cody Severson, the president of Community Uplift Program. And together we created this clinic from scratch, basically.
Okay. Where is it located?
This clinic is actually downtown Fargo in the regional small business office, which is across the street from the Wells Fargo kitty corner to that gas station. But yeah, just downtown Fargo.
Now, are there other clinics like this in North Dakota?
There are other places that will treat trans individuals for transition-related care, but there are no clinics in this state that offer sliding fee scale service, which means that if someone is not making, if someone is in the poverty line, if someone's not making that much money, or they have other situations going on, like maybe they've just been let go from a job, something like that, our clinic is able to reduce the cost of their visit to nothing if need be, to make sure they get the medical care that they need. A clinic like ours there's not another one around until you get to the Twin Cities, pretty much.
So you mentioned Dr. Lenzmeyer. What's his specialty and his involvement with the clinic?
So he is our primary care doctor at the clinic, and his specialty, he's done a lot over the decades of being a medical care provider. He's done a lot with homeless health specifically, but one of the incredible things about him is I didn't know anything about him until he talked to me about a year and a half ago about this clinic, about trans people, about what they needed. And since then, I do a lot of advocacy and education. So I do trainings at other hospitals like Prairie St. John's and places like those. And the amount of doctors, nurses, and social workers who knew who Dr. Richard Lenzmeyer was incredible to me. Like, all these people knew of this guy and the incredible work that he did in the community, that he's always done in this community for decades pretty much. And learning about that through other people as I started to learn about his own work myself was just incredible to me. Like, he is one of the best doctors that I've ever encountered or talked to, like, in my life. He's just an incredible doctor.
Okay. What is an informed consent clinic? What does that mean?
So all medicine operates with the idea of informed consent, which means that you need to give a patient all the risk and benefits of medication for them to be able to make their own consent of care. And a lot of this is implied. A lot of times informed consent is implied. If you go into a clinic for a basic flu shot, you understand, there are going to be risks, there are going to be benefits, et cetera, et cetera. For the purposes of a transition-related clinic, a gender-affirming hormone therapy clinic like ourselves, informed consent means that we understand that patients have the agency to make their own health decisions. So if we give them all the risk and benefits of pursuing hormone therapy, they can make an informed consent decision to pursue that therapy. This is different than standard therapy, or at least therapy that, sorry, not therapy. This is different than regular hormone therapy has been up to about the early 2010 and on, where you often had to have a letter of referral from a therapist qualifying you for this therapy. We've actually seen that a lot of current research has shown that a person does not need to go through a therapist to get a letter of referral, that hormone therapy is very safe and effective. Trans individuals are usually very aware of their own conditions and needs, and what we do is try to make it so they can access those with as little barriers as possible, whether it be so they can see our clinic right away and start getting medication they need, whether it be because they can't afford other places, they need to go through our clinic. For our clinic, it's about accessibility, and most informed clinics, the ones that we are like, operate under these similar models.
Mm-hmm. Are there times when you do require patients see a therapist prior to treatment?
There are times, because if a patient is experiencing severe emotional distress, they cannot give informed consent. So if a person has any kind of mental or physical risk that we think would be a deterrent for this treatment, that's something where we'd look into as a case-by-case basis. And in some cases, yes, recommend they see a therapist for a little bit before pursuing treatment at our clinic.
Okay. How does gender-affirming hormone therapy work?
Effectively. It works well. It's essentially, this is actually going to be quite a long answer, so I'll try to make it succinct, but modern research has understood trans individuals to effectively have an endocrine disorder, meaning that they had the wrong hormones throughout most of their life. And there's consequence to that. Obviously, your body is going to develop different than it should. Your mood and energy are going to be different than it should. But what we do is establish the correct hormones for individuals to make sure that they are what you'd say cis-normative and that their body can operate how it's supposed to. So hormone therapy, the effects of it, what it does for individuals, is it brings their body into balance with what it should be.
Okay. Is this potentially risky or dangerous?
Hormone therapy is proven very safe and very effective according to the World Professional Association of Transgender Health. A lot of people, this is new stuff for a lot of people, but what they don't see is that we've been doing research into the trans condition outside of America since the 19th century. I don't know how the 19th and 20th century work in terms of that, it always throws me up. But So like 1910, we were doing research into this in other countries. In America, we've been doing research in this since the 1950s with Harry Benjamin taking on Christian Jorgensen as a patient. 1950s, 60s, 70s, we've had now 60 years of research into this. So from a medical standpoint, we can see this treatment as being very safe, very effective, very proven. But from a cultural standpoint, we haven't quite got there because for the first couple of years, people are hearing it for the first time. They're hearing, oh no, there are trans people. Is this medication safe? Is it not messing these individuals up? But years of studies, years of research, years of doctors providing this care, and it's gone very well for the people who've gotten the treatment.
Now, so what kind of medical or health issues, may come with hormone therapy?
There are some associated risks. There's not things I can get too much into since I am not a medical doctor. Obviously, I can't make any medical claims on the medication, but there are going to be risks associated with it, but they are the risk associated with hormones in any individual. Like estrogen the higher estrogen, the more risk for blood clots, and that's going to be true for trans women taking hormones. Blood pressure is a thing you have to look at if you're taking testosterone or if your testosterone is too high. Those are some of the risks we look at, but when you sit down with our doctor, there is 2 pages of papers, or there's several pages of papers, but there's things that we look at in terms of if you have this medical history, if you have this family history, will this be a concern? And we always try to mitigate those risks and let people know about them. But for majority of patients, they don't have to really worry about it. For the most people, especially if you're in your younger years, you're not going to really have to expect many complications, if any.
Okay. Does insurance cover such medical procedures?
That's hard to answer. It can. In Minnesota, it can. In Minnesota, it absolutely does, no matter what your insurance is, as long as you're getting it from the state in some capacity, either through the MSure exchange or through Medicare or Medicaid, it does. But each insurance company is a little bit different. If the insurance is coming through a government or government-funded organization, then it has to adhere to the ACA, Affordable Care Act. And the Affordable Care Act means you cannot discriminate against trans individuals, which means if they get a treatment that any cisgender or / not trans individual can get, you can't say no to them. However, there are some places that interpret hormone therapy as something you would do to get surgery. And they don't actually have to cover transitional-related surgery for many states, for many employers, so they can justify not covering a lot of the costs by saying that anything you do as a trans person to transition is related to surgery in some capacity, which not trans people don't have to get, which means they can deny it. So there's not an easy answer to that question, and there's a lot of bureaucracy that goes around what is covered and what isn't. I will say that in the U.S. Trans Survey, a survey that was conducted in 2015, surveying 28,000 trans individuals, they found something like, and I don't have the numbers in front of me, but I believe it was 33% of trans individuals reported their insurance not covering their medical needs. So nationally, about a third of trans individuals with insurance are not getting much benefit from it.
Mm-hmm. So how do you work with patients who have trouble paying?
Well, we are a nonprofit clinic, so we take donations, we take insurance from we take insurance from people who do have it that can cover it, but for people who can't pay, we have a sliding fee scale option for them. Depending on what they make, if they don't make much, maybe we could reduce their bill by 50% or 60 or 70 or 100% if they aren't able to afford it. If they don't qualify for the sliding fee scale, but they have other life events going on, that's something where we can talk with them and say, hey, you can't necessarily pay this, we understand that, but how much can you pay each month? How much can you contribute to it? So we have a lot of patients who are able to pay and are able to make it so we have that sustainability costs. And those patients make it so the people who cannot, who are not as fortunate, are still able to get the medical care that they need.
Mm-hmm. As an activist or whatever,
Yep.
Can you talk about the advances of, in the last few years, I guess, of recognition of transgendered rights?
Kind of like what I was saying earlier in terms of in the last 5 to 10 years, the idea of being trans is culturally really new. In North Dakota, it's especially new. But that's actually part of because of how medicine used to be practiced. In the 1960s and 70s, when we treated a trans patient, what we did was we said, well, to be safe, what you need to do is completely abscond from your previous identity, move to someplace else, and never refer to ever being born as anything other than you are. And they encouraged that because they felt that was the safest thing that they could do for these people, these patients coming to them. And to a point it was. It was safe for them because they got to be able to establish in a new place with a new identity and live their life as happy as can be. But that meant we didn't get much visibility. We didn't get a lot of conversations like we're happening now, like should have been happening since the 60s, 70s, and 80s. We're now just starting to have these conversations. And for a very long time, trans individuals weren't the ones talking about their stories, weren't having the conversations. It was always about trans individuals. And if you look at media representation, at least, trans individuals often showed up as sex workers with like CSI Miami or shows like that. It was very rarely a fleshed out trans character like you would see in today's shows like Sense8 or the mini movies we've had in the last couple of years. Personally, I think Laverne Cox doing the interview with Katie Couric, there's a lot that goes in that interview, but going forward a little bit, we had Laverne Cox on the New York Times, New York Post, something like that. It was a trans tipping point, I believe was the cover of it. And that was in 2014, if I'm not mistaken. I could be, but I think that was a really big pivotal turning point because that was when we started to actually see trans individuals having a voice in this discussion. When we started seeing a lot of trans individuals of color, having a lot of power and agency to define our own condition. And that visibility has been something that has cascaded into more visibility. As we have more people standing up and being role models, as we have more education out there, more people feel safe to come out, safe to have these conversations. And the more people that we have having these conversations, the more people are going to. In 2008, I want to say, again, my years might be slightly off, the visibility for trans individuals was about 8%, which means 8% of individuals personally knew someone who was trans. In 2015 or 2016, they found that 16% of people personally knew someone who was trans. So 16% of people personally knew someone who was trans, which means 84% of people didn't know someone who was trans, which means all the information that they were getting that was informing their decisions was coming from news stations or television shows and not the actual living, breathing people that live through being trans. So I think we've seen a lot more visibility since 5 to 10 years ago, and we've had a lot more conversations, and that's something that we are going to continue to have these moments of education and visibility going forward. So I think trans rights are going to be coming. It's a slow but gradual battle into success.
Okay. Do you think the state of North Dakota at the legislative level is doing much to address the issues for LGBT?
I don't think they're doing anything to address the issues. If you followed the last decade of anti-discrimination legislation hearings, it is very often a couple hours of testimony and support from religious leaders, people in religious communities saying we need this, we need these protections. People in business communities saying that we need to be competitive in the national market, and that's usually what I write about when I talk about these issues. There's a lot of different reasons why we really need this, and we have a lot of different community leaders across North Dakota saying that we need this. And we have hours of testimony from dozens of people representing dozens of backgrounds saying we need this. And then we have 2 or 3 people saying we don't need this, we don't want this, this will violate my rights in some capacity. And then we get a vote that says do not pass these legislations. It goes to the floor and we get a vote that says discrimination doesn't happen, we don't have to worry about this. Regardless if it does or it doesn't, that sends a message to people. It sends a message that if you do experience that, they are not going to care. That no one will hear your experiences, no one will actually be there to support or help you. And if you want to go back to how I was talking about in terms of growing up in this state, when you don't have that support, it's hard to live here. And what we find is a lot of LGBTQ plus individuals move from this state because they don't feel safe here. We have the lowest population of trans individuals of any state in the United States, according to the William Institute. So legislatively, they haven't done anything, and they've sent very strong messages that they don't want to. We might see different with House Bill 1441 is happening right now, which is going to protect sexual orientation, and that may or may not pass. That has yet to come. But I really doubt that we're in a place culturally where we will see those legislation. I think we have a lot more conversation and education before we will see more statewide change.
Okay. Can you talk in general about some of the success stories that you've helped or treated at the clinic?
So not specifically the clinic, but one of the things that has given me the most hope is I hosted a healthcare day at the Pride Center, which is an LGBTQ plus group. And I invited healthcare organizations to the Pride Center to advocate their care. And we had 13 different clinics represented there, 13 different organizations that came to this place to say that they are affirming and they want to make sure that trans individuals, that LGBTQ plus individuals know that they are safe going to these services. And looking around at this room, we have Cass Public Health, we have Red River Women's Clinic, we have Planned Parenthood, we have Sanford Gender Clinic, a lot of organizations representing a lot of the medical community in this area all stepped up and said, we want to do better. And 10 years ago, that wasn't going to happen. 5 years ago, I don't know if that was going to happen, but so many people, at least in the work that I do in terms of medical care, so many directors are having conversations with me, asking me, how can we do better for our patients, for our trans patients? And to me, that is an incredible success. That's an incredibly different playing field than what we were 10 years ago. So situations like that give me a lot of hope. In terms of patients, we've had patients say that our services are what saved their life. That's how important this care can be for some people. And that is incredible as well. So those are some of the success stories we've had with just our clinic, both the medical community seeing what we do and rising up to do better, and our own patients finally having an option they didn't have before.
And you know, I understand some who identify as transgender can have mental health struggles also.
Yep.
Because of everything they've gone through.
Yep.
Can you talk a little bit more about that?
Yeah. So a lot of what happens is that when a trans individual is rejected, that creates a lot of trauma in them. And there's going to be things associated with that, like anxiety or depression. An interesting thing they found is that a transgender individual who was able to indicate early on that they were trans and was treated how they preferred, how they identified, who they were their entire life, they don't have any mental issues different than the general population. As long as individuals can be accepted for who they are, they tend to turn out pretty okay.
Okay. How young is too young to know if one is transgender? You hear stories of parents with children and at young ages identifying this, and it can be a tricky situation with minors.
No, absolutely. So our gender identity, according to developmental psychologists, is something that develops around 3 years of age. Gender identity is is part of our neural anatomy. It is our understanding that our brain has of how our body should develop. So there's going to be people as young as 3 and 4 saying, you know, Mom, I'm not really a boy, I'm a girl. And for these individuals, sometimes you see in the news like parents are forcing transition on their kids or something like that. There is no medical intervention that happens for children. There is only a social transition. This often means, you know, cutting your hair short if you're a trans boy. It means growing your hair long if you're a trans girl. And wearing different clothes, hanging out with different friend groups. There is no medical intervention that happens until puberty hits or until intervention needs to happen. So a lot of times, in this, there's a lot that goes into this as well. Our diagnostic models for identifying gender dysphoria in youth have gotten better and better. You'll hear the idea that 80% of kids grow out of being trans, and that's not the case. That was actually never the case. That was based on studies looking at gay men and seeing that they didn't grow up to be trans women, and of course that didn't happen. So we're still going on in that, but for the most part, it happens on a case-by-case basis, and there's no real medical intervention that happens until someone is ready to give consent in some capacity.
If people want more information, where can they go?
They can go to harborhealthclinic.org, or they can email me at fayeseidler@gmail.com. My email is always open for people to ask questions.
Faye, thanks for joining us today.
Thank you.
Well, that's all we have on Prairie Post this week, and as always, thanks for watching.
Funding provided by the members of Prairie Public.